Welcome to EDU World Space.
Under the idea of production and growth, we're looking at this situation where we're told that incomes per person and the health of a nation are found to be positively correlated. This is in a lot of international data where we see this. So we'd like to know, how might higher income lead to better health? Well, let's start by answering part A here. So higher income may lead to better health because people can now afford better health care, right? Healthcare tends to be fairly expensive, so maybe these people with a higher income, they can afford better healthcare, they can afford better insurance. Maybe they live in areas which are considered to be more healthy areas, right? Because people with higher income, they may be able to invest in greater technology, like pollution emitting technology, things like that. So they're given these better environments in which to live in. So mainly it's going to be affording better healthcare, and that may lead to increased health simply as a result of that higher income. Now, part B, we want to look at it in the opposite direction. How might better health lead to higher income? Well, thinking about people in good health, they tend to be more productive, right? If we're feeling well, we're performing more work and we're probably more productive at the work that we're performing. So this higher rate of productivity is going to lead to higher income because we're simply producing more. So we can expect to earn more as a result. So in that way, we could maybe expect better health to lead to that higher income. And then part C here, we want to know, how might these two ideas from parts A and part B, how might they be relevant for public policy? Well, when we think about public policy, we know that oftentimes it's looking at healthcare. There's a lot of public policy that relates to that. There's also a lot of public policy that relates to incomes and wages and salaries, right? So if public policy is aimed at improving both healthcare and per capita incomes, well, they may want to pay attention to how do they improve incomes, or how do they increase incomes to improve healthcare, or how do they improve healthcare to increase incomes. They work together. So these public policy makers, they need to keep in mind that just taking care of healthcare, if they increase healthcare, they may not get exactly what they want because they need to give a little bit of attention to incomes as well. So they have to work together. They have to go both ways. And that's in the way in which this information could be relevant to public policy.